psychotherapist, not just a center manager. So I've been working in mental health for many, many years. And ADHD is one of the diagnoses we see the most. It's three main things you're going to see with ADHD. It's going to be issues with attention, impulsivity, and hyperactivity. And that's how we know that this issues affect kiddos with ADHD. Some of the things that you'll hear from people around you is that inattention is that they are not focusing, that I call them a little bit of like a Spider-Man, spider kids, because they sense everything. Everything around them distracts them. So if they're supposed to be doing something, they're writing, they're supposed to be working on class, and somebody's talking behind them, they turn and they pay attention to that. Or somebody's walking down the hallway, they turn around and they can't keep focus on one thing. So that's what the inattention comes from, because they cannot separate the stimuli that's going around from themselves. So everything will distract them, and obviously they have difficulties keeping up and learning, because the teacher might be explaining something and then they get distracted and they didn't pay attention, so they miss what the teacher was teaching them. They tend to forget things. Usually their backpacks or the binders are a mess. They make careless mistakes. They get bored easily. It's hard for them to follow instructions. It's hard for them to start tasks, especially if they're boring. A lot of parents ask, well, if he can pay attention to video games, why is he having problems with inattention? Well, video games are very stimulating, and that keeps them really, really on task, and it's fun for them. But math might not be something that's fun for them, so they have a hard time keeping up with math, or reading. Reading is too tedious for them, so they just don't pay attention. It's hard for them to stay on one thing, because if you tell them, hey, come pick up your room, and they start picking up the room, they're going to see a toy and they're going to start playing with the toy, and then they're going to see another toy and they're going to get distracted. Remember, the issue here is that they get distracted easily with any stimuli, noise, movement, anything. Hyperactivity, well, we all have heard about hyperactivity. They move constantly, they can't stay still. You could have lots of activities for them, and sports and soccer and swimming and everything, and they still have energy. It's like endless energy, and they have to be touching everything. So you go to the store and they have to be touching things constantly at the store. They can't sit down for dinner. Even if they're sitting down, they're moving, which could be very frustrating for parents. And the last symptom is impulsivity, and that's why they don't think before they act. They say things that are upsetting to others. It's basically having no filter. So imagine yourself saying what you think all the time without filtering anything. So you would have those issues with the kiddos, because a little friend comes in, had a haircut, they don't like the haircut, they're not going to say something nice. They might say, oh, what did you do to your hair? And they don't mean to be mean. None of this is with the intent of being hurtful. It's just there's no filter, so it all comes out. So there's different levels of ADHD, isn't it? It's not just one type. It's different things that you have to look into your kids. So it has to do how frequent this is. Is it happening all the time? Is it happening at grandma's? Is it happening at school? Is it happening at daycare? Duration, all the time, right? So it's happening all the time, not 1 day yes, 1 week no. It's gonna be all the time, lasting all day long, and it's different intensities. Some kids can be fidgety and be playing with their pen or their hands or their legs move a lot, but they're sitting and they can be moving but still pay attention or be in class. Some kids can't. They have to walk around and move around, and they go see their friends and on the other side of the classroom. That is what you're gonna have to see and measure with a mental health professional in regards to treatment and what's normal for an age group. So if you have a 4-year-old that does all that, well, that's within normal development. The issue is if they're older and they still can't stay still at church or at home or at class, you're gonna look into mild, moderate, and severe. Most of this is seen before age 12. It has to happen in more than 2 places. So it's not just at school. You have to see it in 2 or 3 places. The issues are affecting the quality of life. So if somebody is fidgety, but they still can have good grades or don't have any constant phone calls from the teacher, then you can work with that. But if it's a constant thing, if it's a constant getting in trouble, they are prone to accidents too, so they get hurt sometimes, then you're looking into, this is something that we need to talk to our pediatrician or our mental health professional about. And it's not related to any other issues, related to any other mental health disorders or any other physical disorders. We know that 3 to 5% of all children in the US are affected by it. Half of our referrals are ADHD referrals, either if it's just ruling out. It's a very well-studied disease problem. It's been studied, medication, treatment, all kinds of things have been studied. It's the most frequent studied, DSM-5. DSM-5 is what we use to diagnose mental health problems. Happens more commonly in boys and girls, but doesn't mean that girls do not have ADHD. They tend to be less hyper. So boys get more attention for it because they're more disruptive. But girls do get also ADHD. And usually you'll see it at an early age. And most kids get diagnosed between ages 8 and 10. Now, how it works is that this is a problem that causes other problems. And it all depends on how you deal with the issue when the kids are first diagnosed. 50 to 65% of children with ADHD will continue having difficulties. So this is a chronic situation. This is not just one childhood disorder. It continues through life. So you'll see getting into adolescence, you're going to get a lot more issues that are different because they're impulsive. They tend to take more risks than other kids. So there might be some substance abuse, so that they sometimes use substances to calm themselves down and function better. And they might try using marijuana or other substances to help themselves feel more in control of themselves. There's also learning difficulties and, of course, antisocial behavior. So those are some of the things that could happen. Doesn't necessarily mean that could happen. And we're going to talk about options and how you can help your kids not to get in trouble even when they have ADHD. So this is not a brain damage thing. This is frontal cortex. Our frontal lobe is right here in front of our heads, and it's our executive function manager. That's exactly where all the problem solving, attention, reasoning, planning, everything is like a secretary of the head or a orchestra director. And this part of our brain is what directs the rest of our mind to do certain things. So these issues have to do more with an immature brain than anything else. It has to do with the chemicals in the brain. And that's why most of the time this is an inherited problem. So parents have it, or mom or dad or uncle, somebody in the family usually has this condition, and it gets passed on to the next generation. So it's not proven that it's related to food or additives or vitamin deficiencies or anything like that. That's been proven that that's not the reason for ADHD. And ADHD also is not a reflection of family, a failure of parenting. So I want you to really understand that part. This is not an issue of parenting. This is an issue of the brain, and the brain is not mature enough to do certain things, which is control the impulses, what we call the executive function. So with some of these issues with ADHD come other issues that might be related or caused by it. So you have anxiety, you have some learning disabilities, you have some depression, you have a difficult temperament, mood swings, and it could develop into bigger things like conduct disorder, which is getting into more criminal activity or very defiant. And a lot has to do, and I want you to imagine what it is to be a kid with ADHD with these three symptoms, right? They're constantly being distracted by everything around you. You can't focus on one thing. You're impulsive, so you do and say what you feel in that moment without filtering anything. You are hyper, you're full of energy and have all this energy inside of you. And if you don't, as a parent and us as educators in the school, we don't give you a place to go, yeah, it's very easy to see that they're going to get in trouble because they're bored and they can't focus, so they find ways of entertaining themselves. So that's where the treatment and the parenting skills that are catered to ADHD can come along, and they help. Kids with ADHD develop low self-esteem because everybody's constantly getting at them. Stop, sit down, don't do this, pay attention. Why can't you do this? Why can't, you know, at your age, you should do this and that. They say things, they have no end to energy. So socially, it can be an issue, of course, because if you want to keep going and going and going like the Energizer Bunny and people are tired, they're going to say, I don't want to play anymore, but they want to play. So that can cause some social issues. They say things without meaning to be mean, but they say what they think. And of course, that not having a filter kind of causes issues socially. They get angry because they're tired of people constantly correcting them. And no matter what they do, they're never going to be doing perfect. So they try, and then sometimes they just give up and they get angry. They get depressed and anxious because they don't feel like, no matter what I do, I'm not going to be good enough, or I'm dumb, I don't do good in school. And there comes a predisposition to alcohol and substance abuse, because one is auto-medicating themselves by calming themselves down, because if they don't have medication given, prescribed by a psychiatrist, they will try other things to make themselves feel better. So there's that predisposition for alcohol and substance abuse. Now, not all of it is bad, of course, and what you see and what you hear in media about ADHD is usually a negative thing. But ADHD kids are pretty cool. They have a lot of good, wonderful qualities. They're compassionate. They connect with people in a very special way. People like them naturally, even though they can get annoyed by some of those behaviors. they have a special personality. They're creative. Tons of people, especially in arts and music, are ADHD. They have this endless creativity, and they have this hyper focusing. In hyper focusing, what it means is that they find something. I mean, it could be dinosaurs, it could be Legos, it could be music, it could be anything, and they zero on it, and they just can go hours and hours and hours creating or doing things, and they're completely and absolutely focused on it, and it's really hard to get them out, and really just to have them stop doing what they're doing and go and eat dinner is just a constant fight. So that drive and that energy, if it's put into a very specific and healthy way of dealing with ADHD, can come up with amazing results. They have this drive to work on specific projects that they like. They're very good at problem solving, excellent at problem solving. They always think outside the box. They have a wonderful sense of humor, and they're very down to earth because they're constantly messing up. So they know what it feels to be, not good at something. So they connect very well with people, and they can be very, very funny. They have a resiliency. They bounce back very easily because they are constantly in trouble. So they kind of bounce back very quickly. They're used to it. So it doesn't affect them as much. Of course, over time, it does affect their self-esteem, but they are easier to get out of situations, even if it's criticism or challenges, and they endure. Intuition, they have an amazing way of reasoning things. The way the brain works is amazing for certain things. They come up with ideas. They're very creative, and they really think outside the box. And there's always something, special about ADHD kids. They're just really an interesting group, and they're highly intelligent. I would say most kids with ADHD are very, very intelligent, more than the average. It doesn't show in grades because they can't sit down and finish a piece of paper and get the A that they deserve sometimes. So that's when accommodations and working with the school works. So there's different interventions, but everything that you're going to hear about ADHD related to treatment for them, it has to do with a group of people. Parents can't do it by themselves. Doctors can't do it by themselves. School can't do it by themselves. It has to be all hands on deck kind of approach. So you have different things, and I'm just going to go through this because I have them separated. So of course you want to make sure that whatever issues are happening with your child, that you check with the pediatrician first. You want to make sure the kid is not having any other issues or any other medical concerns that might be affecting him in a certain way. And usually, aside from teachers, who are the ones who send us the most referrals, pediatricians also kind of tell parents, hey, I'm seeing something. So they usually send them to us. So of course, there's many medications for ADHD, and I can answer some specific questions, not about medicine, I'm not a doctor, but about the use of medication. And that has been proven to be the most effective way because, as I explained before, this is all happening right here in the brain, and it's an internal thing. So you can do all the parenting in the world, you can do all the teaching in the world, but if a kid can't focus because it's happening inside his brain, there's really not much we can do about that outside because it's an internal thing. So yes, you will hear medication be spoken about. Again, all goes back to what's the level of functioning of the child? How are they doing in school? Is it the severe issue? Is it a mild issue that we can maybe try to deal with accommodations and other things before we get to medication? Yes, you have to really look at the whole picture. And that's why you need a mental health professional to look into this. And that's why the mental health professional or a psychiatrist will diagnose this, because they can tell you, this is, let's try this first, or let's try this first. But yes, medication is one of the best treatments for ADHD. Parent education, knowing what it is, what it's not. So it is impulsivity, it's inattention, it's hyperactivity. That's not in the control of the child. They have that energy, that's not under their control. They're gonna be hyper no matter what you do. But talking back or throwing things, that's not ADHD. So parents really need to learn what it is and what it's not, to be able to handle and best help your child. So there's different ways of doing, managing the behavior. You're not gonna sit them down, calm them down. They're still gonna be fidgety, but you're gonna choose your battles. You're not gonna spend a lot of time telling your child to stay still, because you will understand that they can't do anything about it. But maybe you can have a rule that, okay, we're gonna sit for dinner. You can sit however you want to, with your foot up or whatever you want, but you're gonna stay on a chair and you're gonna eat. So those are the things that you can talk about with one of our therapists. Support groups, of course, are always very beneficial. Teacher education. So accommodations and other things that can be done in the classroom are very helpful, but also educating teachers about what ADHD is and what ways they can kind of help the child stay on task the best, because it improves the chances of the child paying attention, or if they can pay attention, at least accommodating to them so they can learn in a better way. Individual counseling, and it has to do with teaching the child what ADHD is. Because if they're going to have this the rest of their lives, the best way to deal with it is to teach them what it is, so they know what to expect, dealing with the feelings that come, and understanding their actions, help them to control a little bit some of those symptoms, and thinking and coping skills, and of course social training, social skills. That is a big thing. That is a major thing, because a lot of them have issues with anxiety, depression, and low self-esteem because of their social situation. So yes, maintaining and not just making friends, because they can make friends easily, is maintaining those friendships. That's the hardest thing. Group counseling, those are hard to find. There's not a lot of those because of the same nature of the children. You have to be very specific, very small, and very short in the sessions, and very structured, because they're distracted easily, so it's hard for them to focus and stay on task for a while. So the biggest message is to focus on understanding ADHD, read about it. There's lots and lots of information about ADHD. It's understanding that the child is not doing this on purpose. Those are symptoms that they have that they can't control. They can't control the mouth sometimes. They can't control that hyperactivity, and they can't control that inattention. And that it looks a lot like bad behavior, but it's not. There are things that develop from there, but that you help your child with those symptoms in whatever way you can. And I know there's people who are completely and totally against medication, and that's your decision as a family. But read about the whole thing, not just about medication. There's a lot of things that you can do. I mentioned I was going to talk a little bit about what to do at home, things that you can do to help with those symptoms. especially now when we have the kids at home because they're doing online. That is one of the things that comes up a lot. Is like, now we're dealing with the ADHD at home. I can't make my kid do homework. They won't sit down. They won't pay attention. So some of the things that you can do is, if it's too overwhelming, they have a hard time starting. So I would cut the work into little chunks, 5 minutes or 10 minutes, depending on age, how many, or 5 problems, or, cut into little chunks. Then allow them to walk around and, allow them to walk around a little bit. Don't go and turn the TV on or anything like that, but maybe go and get some water and come back. And then they do 5 more. So you cut into little chunks, and it's easier. It's easier to get them to start working. I'm sorry, my throat is dry. Right when they come home from school, maybe they can have a snack, and then they start doing homework. If you allow them to turn the TV on first, or start playing video games first, it's gonna be really hard to get them out of there. So the best thing is to have a little snack and then sit down and do homework and cut into little chunks. Older kids tend to wear headphones and listen to music. And that's not a bad thing, because a lot of kids have learned ways of coping with distractions. Because remember, inattention, right? Inattention is that you cannot cut out the stimuli around you. So when you have the headphones, you block a lot of that noise that distracts you and doesn't let you finish homework. So some kids, depending on your kid, if they're able to do homework with TV on or with headphones when they get older, that's the way of doing it, if they can do it. If they're distracted, they're watching TV and they're not doing that, then that's a different story. But sometimes that kind of helps to cut out all the distractions. Some schools, and you can make your own, get 2 folders, tape them together and put them in front of them, especially if there's other kids in the house, and that kind of helps them to focus a little bit more, and they are not looking at everybody moving around. For online, it's going to be a lot more monitoring than most parents do, because you want to make sure that they complete things. And of course, rewards, always rewarding, but small rewards kind of helps. Okay, if you finish 5, then we can walk around a little bit. It's going to be learning your child. Some kids have more hyperactivity than they do inattention. Sometimes it's the other way around. They have more inattention and they can stay still for hours. So you're going to have to really look at your child and those 3 symptoms and see what is the most difficult one for them, and problem solve. And you can problem solve with them, and they're very good problem solvers. You can really say, okay, well, how are we going to do this? What would work for you? And if they're in treatment, either medication or therapy, you have to be involved and you have to be part of that process, because they have to learn to manage themselves. Now, a lot of kids don't grow out of it, but they mature enough that they can handle some of those symptoms on their own. They might always be distracted, they might always be kind of impulsive, but that is one of those things you're going to have to work with them. They have to learn to master their ADHD, and that's when you can help the most. That's where management of medication comes around. So I'm going to stop and see if anybody has any questions.
Yes, we have one parent. Here it reads, my almost 7-year-old shows one symptom. 50% of the time she doesn't respond to me calling her. She focuses too much on whatever she does, but she is excellent otherwise. I keep training her. Is this something to watch for? She is great at math, reading, and PE.
I would say that because she's not showing it in more places, and it's she's able to get good grades, I'm assuming, and do great. I would say just watch and ask her what happens, and it could be a little bit of ADHD, a mild, where they hyper focus and they really stay on something. But as long as her quality of life is good and she maintains school and work, and she feels good about herself, and she sees friends, and you see that she eats well, she sleeps well, and all the functioning in her life is normal outside, then she's managing whatever it is very well. I hope that answers the question.
Thank you. Any other parent have any questions? Feel free to put it in the chat. We have a response. A parent says, thank you, it helps. So thank you, Ms. Driscoll.
Sure.
We have another question here.
Oh, yes, I see it. Is there a behavior professional you recommend?
Well, can I do Ms. Rivera, can I talk about youth and family?
Yes, go ahead.
Okay. I don't know if you know, parents, but we have a new mental health services department in Dallas ISD, and I'm the center manager of one of the clinics. We provide mental health services and physical medical services for all students in the district. We have about 13 clinics now, and each school has a clinic that's, I guess, refers kids to, and we have therapists, we have psychiatrists that can do that. For a referral to happen for us, we usually have somebody at the school, usually is the school counselor, fill out a referral and give us, after they talk to you and they work on things. Not everybody, is ADHD, and that's one of the things that we want to make sure that people understand, that there are other issues that might look like ADHD, but they're not. So anxiety looks a lot like ADHD, and it's not, necessarily. Sometimes they coexist, like I talked about, the ADHD starts as like what started first, the egg or the chicken here, and sometimes we start with ADHD and then it develops into anxiety, and then they kind of coexist and kind of feed off each other. Some kids go with depression or behavioral issues. So the first step will be to kind of see if there are any other issues aside from behavioral or attention issues, and then we'll go from there. But it would start with your school counselor referring you to youth and family.
Okay, we have another question. Our daughter is in 5th. She's been on meds for 2 years, still doing remote learning. She has her own space, no sibling to distract her right now. However, college brother will be home in 3 weeks. Any tips on handling their different schedules then?
Yeah, she's a 5th grader, so by now she already has a system that she has created, and if it's working and she's doing good in school, that means that system is working. So maintaining that as much as possible, where if you need to, maybe she will need to move to a more quiet place where there's less talking and less distractions. Remember, the inattention comes from stimuli outside of them, right? So if there's a lot of talking or there's a lot of like TV watching and she gets distracted by it, I would move her to a place where she has more control of the stimuli. Some kids in 5th grade by now, they use headphones and it helps them a lot. It really depends on what works for her, and since she's older now, you can ask her, what do you need? How can I help you? How can we make this work? Because by now she should be solving her own issues really with, if she understands her symptoms, she should be able to start kind of coping with them and find ways of solving them. So asking her will be a good way of starting. And if you need to move some things around the house to give her that space, I would think that would be appropriate.
Thank you. We have a couple more questions.
Sure.
My friend's 4-year-old son is extremely scared of sounds. And he doesn't like the sounds from toys, little alarm beeps, or even a truck moving on the road. How does that, he doesn't like his mom even touching his, to touch the phone, I think. Is this ADHD?
There is a little bit of sensory issues with ADHD, but it sounds to me that there might be something else going on. I would have maybe talk to one of the diagnosticians at the school and see if they can do kind of a quick check on symptoms. There is a small component of that sensory, and sensory has to do with your 5 senses. So some kids with ADHD are very particular about certain textures of food, or the tags in their shirts, or the vacuum cleaner. But they are to a point where they are bothered by it and they don't like it, but it doesn't really physically have a big physical reaction to it. So you have to see how bad is the reaction. 4-year-olds are also having mature nervous system. So that would be something that I would follow up with either school or the pediatrician, because they have questionnaires about different things in development, and see how he or she is doing on those, and that will give you a better idea. With ADHD, you're going to see more than anything the inattention, the impulsivity, and the hyperactivity. That sensory stuff is very mild with ADHD kids.
Okay, so we have time for maybe one more. We have one. I have a 10-year-old who has dyslexia. He was diagnosed back in 2018. When he was tested, they mentioned that he had minor showing of ADHD. He did not have any issues with any of his classes. The only teacher that would keep telling me to get him diagnosed because he would not do well in class. Would you suggest it's necessary to get him tested for ADHD?
And how old is he?
10 years old.
10 years old. Well, what we usually ask parents is if there's a history of teachers or caregivers complaining about things from the time they were starting, well, 4 years old, around there, to today. So that's 6 years of information. So if within this, between 4 and 10 years old, you have never heard any concerns about anybody telling you that he gets distracted or that they can't stay still, I would think that that might be a one situation if it's just one teacher. And I don't think that that would be necessary to test him for anything. I think that the biggest issue is the history, because you're born with ADHD, doesn't develop later on in life. You are born with it, and it shows with the symptoms from very early. By 8 or 10 years old, you already have heard by every single teacher, he gets distracted, he's not able to pay attention, he can't focus. So that would be what I would do first. If there are no complaints from before, then it might be an issue with just one teacher.
Okay, thank you. And there was a follow-up that a student cries uncontrollably when he listens to sound, but they thank you for the advice for the younger child. So thank you so much, Ms. Driscoll, for being here, and thank you so much, parents, for being here as well. We do ask that parents do the feedback form. It is in the chat, so we can continue to have presentations like this. So we do ask that you click on the link in the chat. We have maybe time for one more quick question. What can I do to help with my 7-year-old with his homework? He has ADHD and recently diagnosed with anxiety.
Okay, and is he online or school? So there's at home all the time?
I'm not sure. Ms. Castillo, if you want to answer. We're running out a little bit. Oh, yes, online.
Online. Okay, so you're gonna have to have a very clear structure schedule with him. At this time, we're gonna wake up. At this time, we're gonna eat breakfast. We're gonna brush your teeth. Da, 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 da. So they know what's going on and what happens next. And then, so your school already has your schedule. So let's say you have language arts first, and that's what you're gonna do. So there's gonna be a lot of structure and following up alarms